All right, so welcome to our Kidney Choices Part 2 class. My name is Colette Boroch. I'm the lead care manager here, and I have Dr. Prince with me as well. He is supervising, so just in case you guys hit me with any hard balls, he's here to assist.
Hi, everyone.
There he is. All righty, so let's see. Why are we here today? So we are talking about our different treatments for kidney failure. We have our other class, Choices 1, which we focused on hemodialysis and peritoneal dialysis. But today we're going to focus on kidney transplants and medical management. Okay. All right. So here we have our picture. What is a kidney transplant? So we see from this picture right here, we have a new healthy kidney that is placed in your body. Okay. This kidney here, we see it is placed towards your pelvic region. They do not take out your other kidneys. This is a little less invasive just to add in instead of taking everything else out. Okay. This kidney can either come from a living donor or a deceased donor. So we'll go through those two options and the differences between the two, of course, today. Okay. Who can have a kidney transplant? There are upper age restrictions, but this can differ between centers. So there is no, answer as to how exactly old you can be. When the centers screen you, if you're able to have a kidney transplant, they put you through a couple of different testings that make sure your body is able to withstand the transplant surgery. Okay. Your GFR, or your glomerular filtration rate, which is your kidney filtration percentage, must be 20 or lower. So that means that at any time when this number is at a 20, you're not in a need for dialysis yet, but you could still go ahead and get on the list if you want to be listed, or start looking for potential living donors at this time. Okay. Going back to what I was saying about the full medical evaluation, yes, they do this on every patient. They have to make sure that the body is able to withstand this procedure, as it can be pretty harsh on the body. Okay. You don't already have to be on dialysis. Yes. So we see that your kidney filtration percentage can be at 20%. This is where, a little before you need dialysis, but you can completely avoid it if you have a transplant donor already. Okay. And then each center has different requirements, whether that be on specific age, weight. They want you to have a healthy BMI, hepatitis or HIV status. So most of the times they do screen you ahead of time to see if you would be a candidate for that specific center. Okay. So we'll take a moment here to talk about the transplant process steps. I know there's a lot on this slide, but just to get an idea of what you will be coming into, okay? First of all, if you're interested in the transplant procedure, definitely speak with your nephrologist. Or if you have a care manager with us at PRINEd, speak to them, see if you're a candidate, okay? And then at that point, your doctor will refer you to a transplant center that they normally work well with, okay? So at that time, after you call up the center, they will arrange so that the transplant program will, the coordinators will reach out to you and schedule certain evaluations, such as transplant education. They do educate you a little bit further at that time through the center. They need to do a full medical evaluation. So they'll do EKG, stress tests, a couple of other further testing if you have other underlying conditions. You need to have a psychosocial evaluation. They want to make sure mentally you are prepared to take on this whole new surgery. You're getting a out-of-body kidney. So they want to make sure mentally you are aware of that and that you're aware of what's going on. Okay, they'll do lab tests. Lab tests are a big part of the process with the transplant centers. Usually after you get listed, you're getting tested about once a month. At further imaging as well, they want to see, internal images of your body. And then you will go through a nutrition consult. Okay. At this time, further evaluation may be conducted depending on your health history. Again, if you have further comorbidities or complications. But at this time, if you have a living donor, they will be evaluated as well. Okay, then what happens is the transplant team reviews your case. If it is approved and you need to be listed, you will be listed. If you have a living donor, that surgery can be scheduled. If you do not have a living donor, the team will encourage you to continue the search for a living donor, because the waiting phase right now in New York is usually greater than 5 years for a deceased donor on the list. So obviously, if you have a living donor, you're able to schedule that a lot more quicker than it would be waiting for the deceased donor on the list. Okay. You will be following up yearly with the Transplant Center for health status updates as well. So just because you're healthy when you get listed, they want to make sure you're maintaining that health status. And then when all goes well, once you get the call, you have your donor available, the transplant surgery takes place. There are some post-transplant clinic follow-ups after, which we'll go over on our next slide. Excuse me. So what does the surgery involve? So we'll talk about what's involved here and post-surgery care, okay? So again, as we discussed earlier in the slide, your own kidneys are not typically removed, and then the new kidney is placed in the lower abdomen. The surgery normally lasts about 3 to 5 hours, okay? Patients are typically in the hospital 4 to 6 days after transplant. However, this can change. You could be in the hospital longer, especially if you have more medical conditions, if you have some complications of the surgery. Some transplant centers even keep you a little longer just based on their specific protocols. So this can definitely change. After the surgery, there are frequent follow-ups that are needed, especially in the first couple of months. You're going back to the center once or twice weekly. And then eventually this frequency does decrease. Basically, the center wants to make sure your kidney is not being rejected by the body. So that being said, after the surgery as well, you and your family will be educated about rejection and the rejection medications, okay? So they will talk to you about signs to look out for or complications that could occur and when you need to be reaching out to the clinic. All right, so we'll talk a little bit about transplant coordination. That was a pretty hefty process over the last 2 slides we just went through. I know it was a lot, but I just wanted to let you guys know that in all of these transplant centers, they have a transplant team that is assigned specifically to you to support you from day one, date of referral, the evaluation process. If you're listed while you are on the list, definitely before the surgery, and then after the surgery, just to help coordinate your care, make sure you're going to the appointments you need to go to, getting all the testings that you need for the evaluation done, and answer the questions that may arise through your journey. Okay. All right, so we'll talk about the advantages of a kidney transplant. We know if you are a candidate to have a kidney transplant, this is the best choice here for renal replacement therapy. It does lead to a longer improved quality of life. It absolutely makes it easier to work, study, travel, exercise, and remain active. The last bullet is here, freedom from dialysis routine, but because of that, it does make it easier to do all of, those things like work, study, travel as you used to be able to do it. You don't have to be tied down to that dialysis schedule. There are fewer diet restrictions. You have, this new kidney that's filtering out the toxins naturally with your body's rhythm. So you're definitely going to have to stay healthy. You want to keep that kidney healthy, but it's not as intensive a diet change than it would be on dialysis. With that, you will have better energy, of course, which does lead to fewer hospital admissions and better control of your chronic kidney disease overall. Okay. So we will touch on disadvantages of transplant. Of course, if you don't have insurance or if you have out-of-pocket costs, this could be pretty high. With every surgery, it does have its risks. One of them being rejection of the kidney. Okay. There are medications that you need to be on for as long as you have the transplant. Okay. There are no days off of these medications. You need them the rest of your life if you have a kidney transplant. And then we know all medications have side effects, but these medicines definitely are not candy. They could also increase the risk for diabetes, infections, and some cancers. Okay. And then eventually we know you may need another transplant or dialysis if the transplant does fail. Okay. So where do you get this new kidney? Where does it come from? We'll talk about the different types of donors, okay? One of them would be a living donor, which is a healthy person who wishes to donate one kidney. This will come from either a family member, so your sibling, parent, cousin, other blood relative, a friend, or a spouse. So this is a non-related donor, or you could get it through an anonymous donor. The other type of donor would be a deceased donor. So that is a person who has died and becomes an organ donor. This is what you basically sign up for when you get listed. Okay, this is what you're waiting for on that list. We do want to just point out that it is illegal to buy or sell organs here in the United States. Okay. We have a patient example here.
I was a choral music educator.
My dad is supportive in everything that I've done. I mean, he's like the best dad in the world.
In 2015, I began dialysis. I had so much to live for, and I just felt internally it just wasn't my time. So I was hoping that if a kidney becomes available, my name would come up.
When he told me about dialysis, I think one of the first questions I asked was, can you get a kidney transplant? Like, can I donate a kidney? And we kind of he did a good job of kind of shutting that down quickly, because I don't think in his mind I was ever going to be the person that would do that. But in my mind, that was always an option.
And she just called me one day and said, Dad,
I'm a match.
I said, what do you mean you're a match? She said, for your kidney. And I began to say it, but I told you I didn't want you.
I wasn't like, do you want to do this? I was like, so we're doing it.
And that was the end of that conversation. It was just amazing that she'd want to do that.
And honestly, had I not been able to donate to him, I would have done the pay it forward option where I would donate to someone else and then create this chain.
I remember going to the operating room, and that's probably the last thing I remember The next thing I know, I was up and in recovery.
They told me that right when they put the kidney in him, it started working like right away.
I was surprised it would happen so fast.
I got to see him the very next day, and he was like wide awake, like walking around the hospital.
It's just amazing. She felt well, and she said that a little bit of pain, but not much.
The fact that I was able to do this and recover so quickly, and that he was also able to receive it and continue moving forward it's amazing.
I'm just thankful that that she thought enough of me to keep me around here a little bit longer. She's just such an amazing kid.
Okay, so that was our patient experience, Ron, there. We know that, this is definitely a hard conversation when speaking to somebody about becoming your donor. So I definitely just want to acknowledge that. I have some resources for you guys if you want. I did email you our Padlet board, just some ways to conduct the conversation. As we know, it's a pretty big ask, but we see with Ron, his daughter was more than willing. She even, suggested she give him her kidney. So you never know. We do, again, just encourage you to try to find people, of course, because like we're about to talk about, there are advantages of a living donor over a deceased donor. Okay. So with the living donors, the outcome could overall be better. All right. Because the medical history of the person is known, right? They're getting evaluated right there with you. So they're, they want the donor to be healthier than you, who's receiving the kidney. Okay. This surgery can be planned where, if you're on the list, basically they give you the call and you got to go. Okay. It's at the drop of a hat there. But this you can kind of prepare a little bit more for. There is less rejection in certain studies with the living donor, especially if they are related. That being said, the kidney may even last longer. If you think about it, if you're waiting for a deceased donor, the donor kidney is out of the body for a little bit longer than it would be with that of a living donor, because they have both of you there getting the surgery at the same time, and it's less time out of the body. Okay, this can be done. This is the type of donation that allows the surgery to be done before starting dialysis, as it can be planned, and you're not waiting for 5+ years. Okay. Again, the bottom bullet point here, do you have a living donor? Have you asked? Again, we have some resources for you guys on our Padlet board that could help you map out the conversation. Okay. We'll talk about the disadvantages for the living donor. You just something to think about definitely when asking. This is a healthy person that their kidney is being taken away from them. Okay. There is no medical benefit to the person that is donating. And we know that any surgery can have complications. There's a risk anytime you go under. Even a risk of death is small, but it is still there. Okay. And they could potentially have some long-term risk. So again, just things to keep in mind when speaking to anybody that you're considering as a living donor. Okay, so we'll talk about donor exchange programs, just so you guys know. There are a couple of different transplant centers that have these programs available. Okay, one of them is called a paired exchange. And this is where if you have a donor that is willing to give up their kidney, but they are incompatible with you, they will put you in a program called a paired exchange, which involves 2 living donors and 2 recipients. So we have our picture here to the right of it. We see basically it's a swap. So I think that's a great, idea for if you do have a person who is willing to give up their kidney. Unfortunately, it can't go to their loved one or you who they want to give it to. But if another recipient has a donor that matches with you, they will swap it out. So they'll do the surgery at the same time. Okay. And then there is our other option here, which is the need chain or never ending altruistic donor. So we heard in our story with Ron, she was talking about possibly doing that if she couldn't be a match for her father. So this happens when one non-directed or altruistic potential donor decides to give their kidney for whichever reason. It starts a chain. Okay. In the program, the non-directed donor gives to a person waiting for a transplant where they have a recipient that is willing to donate as well, but is incompatible. So this starts a chain that goes on, and they try to keep it going for as long as possible. So there's definitely, if you do have a donor that unfortunately doesn't match, ask your transplant center if you are attached to one, or you can even look for specific transplant centers in the area that do offer these types of programs. Okay. So we'll talk about the waiting list. Alrighty. Some facts here, you can be on more than one list. Yes, this is true. A lot of patients do this, especially if they have dual residencies. Say, you have a home in Florida. A lot of patients will list in New York and then in Florida. You can only be in one center per state. So you could do that whether you have a house in Pennsylvania, Connecticut, whichever. But again, no one can tell you exactly how long you will wait for the kidney. Okay. The waiting time can depend on your blood type, whatever is available out there. So that being said, the list is not a rank order because it's so dependent on a lot of different variables and factors, but it is a group of eligible candidates. And just so you know, younger patients are given priority on the list. As they are younger, they will get more life out of the kidney given to them. All right. So I have a comparison here of the US national average of living donors versus deceased donor transplant survival stats. We see here on the left, we have living donor and deceased donor. So living donors are top row, deceased at the bottom. In 1 year, we have a comparison. There is about a 4% difference in the survival of living versus deceased. We have the 3 years living is about 94%. And then deceased donor survival is about 87%. Okay. The 1 year and 3 years, it's a little bit more recent data. I had that from the 2019 studies. And then I have a 5-year study, which of course takes a little bit more time to gather this information. This is from 2016, just so you know. We can see there is a significant difference here in the survival. The living donors survived 84% of the time, where the deceased donors survived about 72% of the time. So this again is why we definitely encourage, you guys look out for a living donor if it is possible. All right, so I have another video here. I actually interviewed one of our own PRINEd patients. Okay.
About how your life was after you got the second kidney. Let's talk about your recovery from that. After they found that it wasn't going to fail, how did you feel? Like, what was that process for you?
So I was out of work for about 7 months. Fortunately, again, I've been at my job a long time, so I had the sick time to be out. One thing that I had to come to grips with was it's not, okay, get my kidney and then, yeah, let's walk out the hospital and I'm going to be back to what I was, 10 years prior. It's not that. The recovery time, the getting used to the medications, the anti-rejection medications, they can be a little bit, the side effects can be, altering. So you have to get used to it. And, that surgery is a pretty deep surgery of them putting in a new organ into your body. So you have to recover from that. So, it takes a while for you to get your body back adjusted to the things you have to deal with. And when they first give you your anti-rejection drugs, they have to get you to a point where they want to make sure you're not going to lose that kidney's not going to get anything or your body's not going to attack it, especially me from what happened the first time. So you have to be very careful about germs, wearing masks. I was wearing a mask, before the pandemic, going to the hospital because you have to go to the hospital like every week for that first, month that you get out of the hospital. They have to check your levels. They have to check the kidneys to make sure you're not, getting any infections or anything like that. So it takes a lot of adjusting. It's not an immediate, I'm okay, I'm back to normal. It takes a lot of adjusting, but the end of the journey, well, not the end because I'm still on the journey, but the end when you're physically, strong enough to start to go back to work or to get, go out and do certain things, it definitely is worth the wait. Definitely.
Good. It's definitely good to hear. Yeah, I was going to ask you about that, how, your life as a contrast as it is now to when you were on dialysis. Do you feel like the 10-year wait was worth it?
Definitely. I would do it again, Colette, if, hopefully, knock on, hopefully I don't have to do it anytime soon, but I would definitely, if I had to get back on the transplant list and get another kidney transplant, I would do it because the alternative of, dealing with the machine is not as good as what I'm dealing with right now. Right. You get the time, of course, you get the time back, but you feel so much better. Mm-hmm. I'm able to work out again. I'm able to do physical activities without being, tired or, drained. You have time to, have a relationship or, if you're not, in one already, to have a relationship and, get back to some of that things, the normal life. You still have to deal with, the medications, like I said, but you have more time, you have more energy, your overall health is so much better.
That's awesome. All right.
Okay, so that was our a patient from our own community here. As you could see, he had a very interesting story. For those of you who are listening, I do encourage you to view the complete interview online. It's about 13 minutes, and you could get it on the Padlet that I did share with you guys, the link. Okay.
Well,
all right, and then I have another video here on transplant recovery as well.
In terms of kidney transplant recovery, the patients will be in the hospital for approximately 5 to 6 days, and that's to finish the initial healing process and the medication treatment, and then they are discharged home. They do receive a home health nurse that does come out to their house at least twice a week to help them with their vital signs, help take a look at their incision, answer any questions they have, and even help them with their pill boxes if they need help with that.
The person who donates a kidney in a live donor setting is typically in the hospital for a shorter period of time, typically about a day or two. Their recovery time is a little bit different. These are typically healthy people who don't have any medical problems, who out of goodwill donate an organ. So their primary issue for recovery is going to be pain control, which isn't terrible. I've seen people go back to work in a week or 2 weeks after donating a kidney. I always tell people if you have diabetes, hypertension, we don't cure those with transplant. So you still take diabetic medication, you still take blood pressure medicines. Now we add on anti-rejection medicine, some antibiotics, antiviral medications. We ask that family members be involved or friends so that things like cooking, cleaning, someone else can do that, those sort of things for you. You won't be able to drive in the first typically month or so post-transplant. So we ask, again, that family members, or we call a support team, is involved bringing patients back and forth to the clinic for visits. But the actual recovery time is fairly quick.
For patients to optimize their transplants and get the best success out of it, they need to be respectful of the gift that they are given. And that includes communication with their transplant team in all senses. If there's any questions, problems, concerns, patients do need to contact their transplant nurse or nurse practitioner after transplant. Communication is key. Patients physically need to take care of the transplant by making sure they're eating healthy, they're drinking fluids to keep that transplant healthy. After transplant, life does change for patients. So first of all, they no longer have dialysis. So they have a lot more freedom for travel, for visiting people, going out to eat.
Life after transplant, as long as you have a working kidney, is fabulous. You're not on dialysis. You're spending that 12 hours a week doing other things, being with family, grandchildren, children. Some people go back to work if they're a little younger. Some people go to college. You know, there are some restrictions with infection like that. You need to practice health safety overall, washing your hands and staying away from people who are sick. But other than that, you would never know by looking at someone that they have a kidney transplant.
There's nothing about transplant that's perfect. So I won't tell people to expect a perfect outcome, but expect a good outcome. You're going to be taken care of by some really good physicians and care providers. Everyone, our team is very caring.
We really are personalized on our patient care. Patients are not just numbers to us, they are people. And we do care about their lives and their results and their kidney transplants.
All right, there we have it. Okay, so I did just want to open it up if you guys have any questions about the transplant, the process, donors. If you want, definitely unmute yourself and call out. Okay, no worries. You guys do have my email information, so feel free to shoot any questions over to me and I'll try to answer them as well afterwards. So we'll take some time now to talk about our other option here, which is medical management. What is medical management? It is using medications to control symptoms of kidney failure. We know that this is a big decision. A lot of people, or some people, will want dialysis to go through with it, and others may not be so sure. So if you don't choose to have dialysis or a kidney transplant, then you will end up losing your kidney function over time. But the doctors will keep you comfortable with medication and hospice or palliative care, since we know dialysis or transplant is not for everybody. Okay. Let's see. So we'll take a moment here to talk about advanced directives or living wills. This is important for, I think, everybody who is either planning to have a surgery or just in general. I think it's a great idea to set these expectations for your family. Okay, it tells who will make your medical decisions if you are unable to make them yourself. All right, it maps out the specifics of what you want for health and medical care. And it outlines what type of care you want, from CPR to feeding tube to intubation to medications to dialysis. So this definitely takes some thought and planning, but it does make decisions easier on your family, especially if you are unable to make these decisions. Okay, some common questions that many patients think, after getting this type of education. How do I know what is the best choice for me? Yes, so definitely speaking with your nephrologist, see what they think is best for you. See, what their advice is. I would definitely keep that communication open and be comfortable with speaking about these things with your nephrologist. They can definitely recommend, the best opinion, as they've seen many patients go through this. Okay. If you are in CKD, whether it be 3 to 5, you are in medical management now. If you have any conditions, you're taking medications to control these conditions. But no matter what, just so you know, these are choices, right? You do have the choice to move from these different models, okay? If you decide you want to be on peritoneal dialysis, but you're not comfortable with it, eventually you could go over to hemodialysis, or you could also move to medical management if you're not comfortable with that decision anymore, okay? We definitely just want you to take charge and understand that it is your treatment, your body, and it is your choice. We're definitely here to give you advice if needed, but at the end of the day, you need to do with what's most comfortable for you. Okay, so we have our little quiz here. I know we don't have many on the line, but if you wish to participate, go ahead. We're going to ask a couple of true or false questions. I might have Susan here cheat with me a little bit. Number 1, dialysis can cure kidney disease. If anybody wants to join in. Okay.
It is a treatment, not a cure.
Right, exactly. So false. Dialysis, as Sue just said, it is a treatment. It is not a cure. And we have 2. Dialysis can only be done in a center. This is a little unfair because I don't know if everybody here had joined our dialysis class, but this is false.
False.
Okay, great. Exactly. Dialysis can be done at home, which we did learn in our Choices 1 class. Okay. Number 3, you must be on dialysis to get a transplant or to be listed.
False.
Yes, exactly. That is false. If your kidney filtration rate is at 20%, you don't need dialysis yet, but you could certainly have a surgery planned ahead of starting dialysis or be listed. Thank you. 4, the best option for kidney transplant is a blood-related family member. Think about this. Okay, so this is true. Yes, if you have a blood-related family member that is a match for you, it does have the least amount of rejection. Number 5, it is illegal in the United States to buy a kidney to use for a transplant if the wait list is too long.
True.
Very true.
True, yes. Okay, 6, you cannot be on more than one transplant waiting list.
False.
Correct. Like we spoke about, if you have dual residencies, you could be listed in multiple states. Number 7, transplants overall lead to better energy and fewer hospital admits. True.
Good option.
Yes. 8, renal replacement therapy, including dialysis or transplant, is not for everyone. True. Yes. Spoke about that. All right. Good job, guys. Hold on. Oh. Gotta go back. Sorry. All right. Well, we got to the end of it. I just want to let everybody know here. We do offer chronic care management services here with our PRINEd team. Just to continue the discussion and education, I know obviously we could take this time to give you the education, but it could take some time to digest. So I think this is a great program for our patients that are going through this decision process. Okay. What are key features that we do with our patients? We coordinate care plans. Okay. Our patients can obtain additional kidney disease education and resources to help you make the best decision. Okay. This takes place on a monthly basis. It's usually about 20 minutes per month over the phone. All right. And the goal is to optimize your overall kidney health. Okay. And again, thank you so much for joining us today. I hope this was helpful. All righty. And like I said, if you have any questions you think about, feel free to shoot an email over to me and we will get you an answer. All right, guys. Thank you. Have a great day.
Thank you.
Bye.
Bye-bye. All right, so I got a